Welcome back to McLaren Port Huron's Today's Health program. I'm speaking now with McLaren Port Huron's robotics specialist, Steve Schlitt. Steve, welcome to the program.
Hello, thanks for having me.
Can you describe for us the surgical robotic system that is used at McLaren Port Huron?
Yeah, at McLaren Port Huron, we are using the Vinci SI surgical system. A little bit of a history, in 1999 is when the first robotic system came out from Intuitive Surgical. And since then, in 2006, they came out with a Vinci S surgical system. In 2009, they came out with the Vinci SI surgical system, which is the system that we currently have at McLaren Port Huron. And just in the past year or so, they also developed and came out with a Vinci XI surgical platform. So there's been 4 generations of Vinci robots. The one thing I can say is that with all generations of the robots, they all consist of 3 different components. So there's the vision cart, which displays the surgical site of where the surgeon is viewing on an HD monitor. And then there's the surgeon console, where the physician actually sits down and manipulates the robotic instrumentation and the camera. And then there's the patient cart, which is actually the cart that's holding the instrumentation and the camera and allowing the surgeon to view the surgical site and manipulate the instrumentation all at the same time.
So in essence, the surgeon is sitting at the robot and performing the surgery through the robot on the patient.
Yep, it's all kind of done through data cables. So there's a connection between where the surgeon is sitting and controlling the master controllers, as we call them, and it's controlling the actual instrumentation and the camera at a different patient cart, which is actually what's doing the manipulations.
What type of training do the physicians need to use the Vinci robot?
They do go through quite extensive training. So what they do is we set up what is called a dry lab, and they come into the OR where we set up some models and some drills and stuff to get them used to the controls of the hands and the foot pedals and all the different components of that surgeon console that we were discussing. After they get comfortable with some of those controls, we set up a pig or cadaver lab that they actually have to go out to training at a specific hospital set up by Intuitive. And they sit there for probably about 8-hour day and perform different tasks, either on a pig or a cadaver. And once they pass that, they get a certificate that they have to present to the hospital. Once that's completed, they do have to perform at least 3 procedures under the watch of a skilled Vinci surgeon and get signed off and written consent before they can begin to perform their own procedures.
What is the benefit for the physicians in using the Vinci robot?
There's many benefits, I'm sure, as Dr. Ahad has mentioned. For them, it's the vision. So they get to see through that stereoscopic view at the surgeon console a 3-dimensional image, as well as a 10 times magnified and crystal clear HD view of the surgical site. So all the anatomy that they get to see when they have the belly open for an open procedure, they actually get to see through the endoscope on just a small 2-centimeter incision with a 3-dimensional view, crystal clear HD. So they actually get a really almost better view of the anatomy than they would with their own eyes, which is very nice. Another advantage that they have is the instrumentation. So the Vinci allows them to be able to manipulate their wrists with the instruments. Normally with laparoscopic surgery, it's more of just an open and close straight stick jaw. So if it's like a grasper, it can really just open and close. There's no manipulating the wrists or turning of any sort. But with the Vinci, it allows them to be able to rotate their wrists and be able to turn it in ways that they would never be able to with their own hands. And the biggest benefit, I think, that doesn't get mentioned very often is just the physical relief that they get from using the robot. I've seen a lot of doctors that have performed open and laparoscopic surgeries for many, many years have a lot of shoulder and neck pains from the hours and hours of standing over a patient and looking down at the surgical site in a static environment and just working away to where they develop some issues. Whereas with the Vinci console, they're sitting down in a comfortable chair and they're controlling the robot very meticulously and very precise, and to me performing just as good, if not better, procedures and extending their surgical life as well.
Now, I hear at the hospital that you are affectionately referred to as Da Vinci Steve. So can you tell us what types of procedures that the Da Vinci is used for?
Absolutely, and thank you for mentioning that. There's many procedures that the Da Vinci can do, and the FDA has cleared it for. Anything from gynecological procedures, doing hysterectomies, or removal of fibroids. Urology uses it as well for prostatectomies, removing the prostate. They do kidney and partial kidney removals. They do bladder work as well for bladder cancer. General surgery, as we all know, are using it for an array of things, from gallbladder surgeries to hernia repairs, as well as colectomies and bariatric surgeries. And there's also thoracic and cardiac work as well that can be done using the robot. Specifically here at McLaren Port Huron, we're doing specifically gynecology, so we're doing hysterectomies and fibroid removals. We're doing the prostatectomies with urology, and we are just starting to vamp up general surgery with the lap chole or gallbladder removal, as well as the hernia repairs. So those are the three main focuses that we have right now.
Now, we hear a lot about robotic surgery in general. How does the Da Vinci robot compare to other robotic surgery systems?
In general, the Da Vinci robot is the only actual robotic platform that is completely surgeon controlled. There's a lot of amazing technological advances in the medical industry with orthopedic mapping and telecommunications and things of that nature. But there's really nothing that's surgeon controlled completely that can perform the procedures that the Da Vinci robot can do.
What are the benefits to the patient of having the Da Vinci robot used?
The benefits to the patient are actually more exciting than to the surgeons, which makes it so intriguing. So they have less scarring normally. They're doing 3 to 4 very small 2-centimeter incisions. There's a lot less pain, both at the incision site as well as post-operative pain. During the procedure, there's less blood loss typically, less risk of complications. And the best part, the robot actually allows the surgeons to offer a minimally invasive approach to a more broad base of patients. Since it's so technically advanced, a lot of times laparoscopic surgery isn't available to them because of certain situations, and that is where the robot kind of steps in and can increase that gap to where they can receive minimally invasive surgery without having to get a large open surgery done.
Steve, this has been great information. How exciting to have the Da Vinci available right here at McLaren Port Huron. Thank you for joining us today.
Thanks so much for having me.
And thank you for watching. If you have questions, need a physician referral, or have suggestions for topics you'd like to hear more about, you can contact us by calling Health Access at 1-800-228-1484. You can also watch Today's Health, request a copy of our program, and access other reliable healthcare information by visiting our website. As always, tune in next time to Today's Health. Today's Health is brought to you by McLaren Port Huron.